Welcome to another edition of Let's Learn Together. And please, after watching the video, please kindly subscribe by pressing the subscribe button. Thank you very much. Today, we are taking a special lifestyle behavior of people on medication use, how people's lifestyle and taking medication, and how actually the causes of why these people respond to drug therapy this way. So in a nutshell, we will look into medication adherence and compliance. Medication adherence, like medically, medication adherence or compliance is the degree at which an individual an individual's lifestyle or behavior corresponds to the prescribers or maybe the health providers recommended advice on how to take the medication. And medication adherence, we're looking at the lifestyle of the person. Are you taking this drug as you should? So in a nutshell, medication adherence is the ability of an individual to take his or her medicine the way it is being prescribed, or do the things that the prescriber or the pharmacist says you should do. Looking at taking your drug with food, looking at taking it without alcohol, looking at taking it with normal water and the rest, and looking at other lifestyle modifications or dietary modifications that you must adhere while taking your medication. So what are the possible causes, or why do people not adhere to medications? Medication adherence, it should be the primary goal of every person while taking medication, because actually if you're not taking your medications, there's no how you feel well. So why do people not take their medications? One major thing is let me start with external factors. The person is busy. Natural factors. Naturally, people don't like taking medication. People don't like taking meds. So you're looking at lifestyle modifications, external factors. We're also looking at the drug factor itself. The fear of side effects make people not to complete their dose, for example. And also polypharmacy too, that is taking multiple drugs, at least 4 to 5 drugs at a time, makes people to be scared of taking medications, of adhering to medications. The cost of therapy too, the cost of drugs too makes people, for example, if for example amoxicillin, for example, is sold at 500 naira, and you have to take to complete your therapy, you have to take, for example, therapy is for 10 days. People will likely not adhere throughout the 10 days. And also the route of administration too is another factor that leads to medication adherence. There are people that don't like taking capsules. There are people that don't like taking oral drugs. They prefer injection. So in this case, you have to discuss with your physician. You have to discuss with your pharmacist on the preferred routes. These are things you discuss. What route do you prefer taking your medications? Because if, for example, you are supposed to take ceftriaxone as in for 3 days for treating maybe UTI infection or maybe any type of infection, and you don't like injection. So the first day you go, maybe you go and you are okay, and also it will take someone that likes taking injection to go back and complete the 3 days. So that's another factor that leads to non-adherence. Another factor that leads to non-adherence is majorly most people don't complete their doses when they start feeling well. And you see most people taking they start anti-malaria maybe the first day, second day, before the third day, when they start feeling well and all, when they've relieved of symptoms, they go. They don't take their medications any longer. And another reason why people don't like adhering to medication is comorbidity. Like if the person is having multi-disease condition, the person is diabetic, the person is hypertensive, the patient is epileptic, the patient is has dyslipidemia, the patient is having other conditions. So it's likely that the patient will not be taking their medications, like on people on chronic conditions and multi-chronic conditions will not likely comply with their medication. I believe I've been able to discuss all you need to know about medication adherence. And how do you adhere to medication? One of the first things, at least, you have to discuss with your doctor, you have to discuss with your pharmacist on the preferred route. Which route do you prefer? As in, which dosage form do you like? If you like taking drugs, if you like oral drugs, you should be able to discuss with your pharmacist or discuss with your doctor. If you like taking injections, you should be able to discuss with your doctor and your pharmacist too, so that they know the preferred route to go about. And also, we have let me quickly look at the clinical, let me quickly look at the effects of not what is likely going to happen if you are not complying with your medication. This is what is going to happen. I would dividing it into two outcomes. We're looking at clinical outcomes and economic outcome. Clinically, if you are not taking your medication the way you're supposed to, if you don't complete your dose, what happens is you will not feel well. You will not feel well as you should, and it will either prolong duration of disease or duration of the condition. It's either you will have other, maybe, when you have taken a drug and the drug is supposed to be work for 5 days and you're taking it for just the first day, the symptoms will come back. Especially when most people, when they feel well, they go back. So when the symptom comes back, it becomes a problem clinically. So you have negative clinical outcomes. And also economic outcomes.